The 70th anniversary of the Catholic Health Association of India and its annual general body meeting was hosted at St. John's National Academy of Health Sciences, Bangalore on the 25th and 26th of October 2013. 6 parallel workshops conducted for 3 days prior to the AGBM were attended by over 400 health workers from across the country. While the workshops on emergency nursing management as well as palliative care was conducted at St. John's Academy campus, Snehadan Pastoral Health Center hosted the workshop on challenges of NRHM. Whereas the workshop on diabetes management was held at Dharmaram Vidyashetram. Medico-legal awareness and finance management training was at the Passionist Jyotir Bhavan, and disability mainstreaming workshop was held at Maitreya. On 25th October, the program began with the Holy Mass led by His Grace Vincent Conceição, Chairman, CBCI Commission for Healthcare.
And of the Son and of the Holy Spirit.
Amen.
Peace be with you.
And with your spirit.
वंदन ईश्वर वंदन हो, ईश्वर वचनों को वंदन हो, वंदन ईश्वर वंदन हो, ईश्वर वचनों को वंदन हो.
He also hoisted the flag to inaugurate the program. In the first session of the AGBM, Father Julius Arakel, President of CHAI, and Father Tommy Thomas, its Director General, set the tone for the 2-day program. The presidential address was given by Mar Joseph Armachadat, Chairperson, Health Commission, KRCBC. Speakers from diverse backgrounds appreciated CHAI and offered their suggestions.
I'm proud. I'm really proud and overwhelmed with pleasure to see this huge gathering of CHAI. It proves the miracle of our unity.
We are celebrating 70 years, and during this last 70 years, CHAI has done marvelous work. And as I always say, CHAI is not Tommy Thomas, CHAI is not the central office, CHAI is not the regional office or its office bearers, but CHAI is each one of you.
As you all gather here in the fond memory of the founder of CHAI to celebrate the 70th year of its existence, I once again wish you a very fruitful session of annual general body meeting.
I always think of 2 Indias that we have in front of us. The urban India and the rural Bharat. आप लोगों ने कोने कोने से आया है यहाँ, भारत का कोने कोने से आया है यहाँ, एक मकसद था, health. And you people have come from such far off places, and that's the rural Bharat.
At the outset, I would like to wish a happy birthday to CHAI. This is a milestone.
There are so many challenges, but one of the greatest challenges I see outside us is the increasing tendency to consider healthcare as an industry.
CHAI today has grown to become the largest charitable, voluntary, non-profit Catholic organization in the world.
It was a joy to listen to the experience of the special guest of the program, Padma Shri Srimati Phoolbasan Bai Yadav.
सबसे पहले आपके ये संस्थला बहुत बहुत धन्यवाद देना चाहता हूँ, जो राजनांदगांव एक छोटे से जिला में माँ बमलेश्वरी फेडरेशन के एक गांव के महिला ला बुला के जो मान सम्मान दी सोकर पर बहुत बहुत धन्यवाद. आज ये कार्यक्रम में हमारे बीच में मंच में विराजमान जम्मू अतिथि मल्ला और कथे ना धरती के भगवान जो डॉक्टर और जो सिस्टर हर घर में खुशी देने वाला जम्मू डॉक्टर सिस्टर ला मोर तरफ से प्रणाम.
The 8 congregations which were part of the first executive body of CHAI were felicitated.
Sister Anbrasai, presentation of the Blessed Virgin Mary, who belongs to the Religious of the Good Shepherd congregation, my current employers at St. Martha's Hospital. Ms. Rowena McNally is the President of the Catholic Health Australia, the Director of International Committee of Catholic Healthcare Institutions.
The winners of the essay competitions conducted as part of the anniversary were awarded by Father Joe Mannath, the Secretary of CRI.
In much of the West, particularly Europe and Canada, not the US sister will know much better than I do, over 40 million people uninsured. The Canadian system, which I think was thought out by a Catholic doctor, is universal coverage. And its principle is the treatment should be according to need, not the ability to pay. We are far from this.
CHAI Herbal Calendar 2014 was released by Dr. Bimal Charles, General Secretary.
It's such a privilege to stand together and look up to God and also do something what God had commanded us to do for this country.
Representatives of similar networks in other countries, as well as from global funding agencies, paid tributes to CHAI and also offered symbolic gifts.
I've got a very, very small presentation to give to the Catholic Health Association of India to commemorate your 70 years.
I want to thank Father Tommy for giving me this wonderful opportunity.
For the past 70 years, CHAI has been leading India in healthcare education and practice.
Thank you for giving me the opportunity to say a few words on behalf of Miseria.
In the scientific session, moderated by Father John Vattamattam, CHAI's strategic discussion paper was presented by Father Julius Arakal. Eminent persons in the field from across the globe dialogued on its various aspects, which is followed by presentation of the different regional units. One of the major focus of the day was a celebration of the founder of CHAI, Sister Dr. Mary Glowry of the JMG congregation, being made a servant of God. Sister Sundari, provincial of the Bangalore province, spoke about her joy on the occasion.
It is a source of great joy and pleasure to wish and congratulate each member of CHAI who are present here to take part in the celebration that marks its completion of 70 glorious years in the service of humanity.
An exhibition on the founder was inaugurated by Sister Fatima, Vice Provincial of the Hyderabad province. A short movie on her life, as well as her biography, was released by CHAI.
Sister Carol Kihan is the 9th President
The cultural programs from various institutions and beneficiary groups of CHAI were a fitting finale for the evening in the founder's honor. The second day began with the business session of chai, followed by the Holy Mass celebrated by His Grace Bernard Morris, Archbishop of Bangalore.
Holy Father says it is necessary to work with a greater commitment.
Sister Dr. Mary Glowry Awards were presented at the function.
The citation reads, Sister Dr. Mary Glowry Award for Doctors presented to Sister Dominique Maria in recognition of her outstanding service in the field of healthcare. Sister Dr. Mary Glowry Award for Nurses presented to Sister Annie Matthew SCJM in recognition of her outstanding service in the field of nursing.
To present the Sister Dr. Mary Glowry Award for the Best Social Worker to Sister Annie Sebastian in recognition of her outstanding work as a social worker. Present the Sister Dr. Mary Glowry Award for outstanding contribution in the field of community health to Sister Innocent in recognition of the commendable work done in the area of alternative system of medicine.
Various new initiatives were launched by Chai at the function. Chai Children's Health Club was introduced by Father Joseph Manipadam and launched by Mar Joseph Arumachadat.
First of all, I would like to thank in the outset itself.
I also congratulate Chai for the initiative they take in establishing the health clubs to our children or in our schools in collaboration with the CBCI Commission for Education and Culture.
Social Workers Association of India was inaugurated by His Grace Vincent Conceição.
With these few words, I am pleased to launch out SWI and wish the joint venture all the best.
I invite the Honorable Minister of Home, Karnataka, Shri K.J. George, to now release the souvenir and hand over the first copy to His Grace Archbishop Bernard Morris.
It's a great privilege for me to come and address all of you. I am happy to be here for the public function celebrating 70th year of Catholic Health Association of India.
Reverend Father George Kannandanam, Director, Project Vision Bengaluru, to do a presentation on the eye donation.
Eyes are too precious to be buried. Eyes are too precious to be burned. They can give sight. So please donate your eyes. The minister would read out the pledge and we would all respond to it.
Realizing the suffering of the visually challenged persons.
Realizing the suffering of the visually challenged persons.
And understanding the spirit of Jesus and the church.
And understanding the spirit of Jesus and the church.
In line with the global commitments.
In line with the global commitments.
With full knowledge and conviction.
With full knowledge and conviction.
I pledge to donate my eyes after my death.
I pledge to donate my eyes after my death.
To bring sight to any blind persons.
To bring sight to any blind persons.
And to work for the cause of blindness.
And to work for the cause of blindness.
Thank you.
Father Jose Ayamkudi, President Catholic Health Association of Karnataka, thanked everyone for their cooperation.
Now it is my turn as the President of Chai Karnataka to give a loud expression of our gratitude to each and every one of you for your valuable presence, help, guidance support, service to organize, conduct this 70th annual general body meeting of CHAI at St. John's, Bangalore.
2 days, 1,000 participants, representatives from global agencies, many eminent persons, several presentations and ideas, new initiatives. CHAI's 70th anniversary and annual general body was a time to know its work, evaluate the past 70 years and look towards a centenary. Above all, it was a time to venerate Sister Dr. Mary Glowry, the servant of God who initiated this movement 70 years ago.